Hey guys, I'm Jeannine Lesante and I am back with brand new shows here on Skin Sense, answering some of your personal questions that you've been sending me. We're here at Derm Dox in Hazleton, and when we come back we are going to be talking about two procedures today, Botox and Microdermabrasion. And you're watching Skin Sense here on SSP TV. Don't forget you could download the app and watch all of our programming. This is a new show as we start off the fall season. We're here at Derm Dox and we're back with Maryann, and we love to have our guests on because you love to see procedures. We're here with one of my friends, Liza. So Liza, thanks for coming.
You're welcome.
She's all prepped and you just got back from vacation, right?
Yes. 8 days in the sun.
8 days in the sun, and here in Pennsylvania, we soak up the sun in the summer because we don't see a lot of it, right?
Especially with all the rain we've had. Yeah, absolutely.
Yes.
What kind of summer did we have?
Well,
with all the rain, but whatever.
Rain and sunshine, but we at least got out there and enjoyed ourselves and went on vacation. Yeah. So now we're here to wipe away all of the dry skin, and this is a good time of year to get microdermabrasion.
This is the perfect time. You can get microderms any time of the year, you know, but it is good, like you said, after you've exposed yourself to the sun and whatnot. And it's really better after you're all done with vacationing and things like that, because if you want to do this and then go out in the sun, this makes you a little more sun sensitive, like everything else.
So Liza's all excited. She said it's like Christmas.
It is like Christmas.
So today we're going to do microdermabrasion, and we're also going to do Botox. One of my favorites. A lot of you ask about it privately. Some people are private about what they get done. I like to be open and honest with people who say your skin looks great. What do you do? What kind of products do you use? And again, when you see people like the Kardashians out there saying, buy my makeup, you'll look younger. Well, they're also getting procedures done, and they're safe procedures that you can also get done here locally. Just make sure you're getting it done by a licensed dermatologist and people who have the credentials to do the work that you want done. So today, the microdermabrasion, tell our audience first of all what that is.
Okay, Jeannine, we've done microderms on TV, frequently. I'm sure a lot of you have seen us do these. What it is it's a light sanding procedure. We use the Belladerma microderma machine, and it has different settings on it, 1 to 5. So we kind of adjust it to the person's skin type and whatnot. And since I've never done Liza before, we're going to put it on a lower setting until I get accustomed to her skin and see what she can handle. It's a non-invasive treatment. Nothing happens to your skin. When you leave here, no one's going to say, oh my gosh, what happened to you? Because it's just, like I said, a very gentle treatment. And it's good for fine lines and wrinkles. It's good for getting your skin back to normal after you sort of damaged it a little bit with sun exposure and the dryness and all that. So it kind of puts your natural pH back into your skin, gives you a little glow, and helps your makeup go on smoother, for the women. So nice treatment.
Now, have you had any work done on your face before?
No, I've never had dermabrasion or anything like that.
And she has good skin.
Yes. Is your skin dry, oily?
It's a little bit of a mix. I have the T-zone mix.
As most people do.
Right now, I would say I'm on the dry side from the 8 days in the sun. Use sunscreen, but it's never enough.
Sure.
Okay. And then does it matter what they use on their face? Does it matter what kind of products you use? Is it better to use products or soap, or what do you
We always recommend for your cleansers and that mild and gentle. I mean, that's the thing. Anything that's mild and gentle, Cetaphil products are good. Anything that does not strip the skin, if it's natural oils and that. A lot of people overwork their skin. They'll do masks and they'll do astringents and all these kind of things. It's really not that necessary to do those things, especially if your skin is a little bit on the dry side.
Okay.
And if it's on the oily side, try and get water-based products, as far as your foundations and makeups. Don't get things with heavy oils and things like that, because those tend to clog the pores. Even if you feel your skin is dry, those things still tend to clog the pores. So you want to stay away from anything too heavy and too harsh. Okay, and she doesn't have any, well, she has a little bit, but not very much makeup on here. So basically that's what we do. That's how we start the procedure.
She has that nice tan.
She does. She does. Now, of course, we don't recommend tanning beds.
Right,
that's
no tanning beds.
A no. As far as that goes, and for obvious reasons. I mean, it has been proven that these things will cause skin cancers in the long run and whatnot. We have a nice green mask here.
Oh, here we go.
Okay, and this is good. This is good for if your skin's a little bit oily, but if it's dry, it's not going to hurt anything either. And that's what we put on first, because this acts like a little preparation for the treatment itself. Okay, so we let that dry a little bit. Masks too, they shouldn't be overused. I mean, you can use them maybe once or twice a week depending how oily your skin is and that, but they too can strip the skin if you use them too frequently.
I am not a fan of
Mask
for myself. When people ask what I use,
Yeah.
you know, I use a lot of Dermatologist products from Robert Stevens.
Sure.
But again, use what works for you.
That's right.
A
that's
makeup
right.
remover, something for the eyes.
Years ago, they used to have these really harsh scrubs out. I think they probably
they
still
still
do.
do.
You know, with the peach,
Yes.
you know, all of that real gritty kind of stuff. You can actually scrape your skin and, you know, damage your skin by using those and using them too frequently. And if your skin is more of a sensitive type, I know I can't use something like that. It's like these ground peach pits and things like that, and it's very gritty. It's like putting little stones on your face.
Yeah.
You know? So you can imagine I rub that in. If I were rubbing like gritty stuff like stones and stuff in her face, that would really cause some problems.
Right.
So we're going to take that off again for time's sake
Okay.
so that we can move on to the next step.
So this is all prepping the skin.
This is
correct?
prepping the skin for the treatment. Right.
And how popular now are microdermabrasions?
They're
with
very
all the
popular.
other-
They've always been popular. I do a lot of them. Our next procedure up from this is microneedling, which works kind of in the same fashion. I mean, you prep the skin and then you use the microneedling device, which is just what it says. It's a bunch of small needles that kind of, you know, go around in circles, and that's the next step up if you have maybe deeper scarring and, you know, acne scarring and things like that, that you want to get to the next level.
And what kind of procedures can you get if you do have Botox or filler or any other kind of cosmetic procedures done to
You
your
can
face?
get any of these, any of these treatments done if you're doing cosmetic treatments. It's just you don't want to do them on the same day. You can do them on the same day if we do this first and then the Botox, but not vice versa.
And do you get a better result if you do this than the Botox, just because your skin is already...
Well, when you're doing fillers, you're putting like maybe little microscopic holes, you know, here and there, you know, and the same thing with the microneedling. I wouldn't do a microneedling and Botox or filler the same day. But a procedure as mild and gentle as the microderm, we can do fillers after that.
Perfect.
Uh-huh.
How you feeling there, Eliza?
It feels really
It's
good.
a little pampering.
Yes.
And you'll feel that your skin is nice and smooth after we do this. And again, women usually comment that their makeup goes on a lot nicer after one of these, and you'll see. And again, people know when they want another one of these. They can tell by how their skin feels.
You get spoiled.
It feels a little tingly now.
Does it?
It feels, I guess the best
Clean.
word is fresh. Yeah.
Fresh. Okay. So now if I were to stop right here, this is like a little treatment in itself.
Yeah.
I mean, her skin already looks a little bit fresher and all of that. So, and if you could feel that it's already a little bit softer too. Okay, and now we're going to start with our treatment.
Oh yeah,
Like a baby's bottom.
it is like a baby.
There you go.
Wow.
This part's cool. And explain what is actually in that. Is it like
This
crystals?
is aluminum oxide crystals.
Okay.
That's what this is. There's different mediums that you can use, but this is the one that we use. And what it does a gentle sanding procedure of the skin. And so any of her, you know, dry skin, her flakiness and that should all get resolved with this.
Okay.
And that's it's going to get rid of all of that for her.
Again, you do it right here in the office. You're licensed, and you've been doing this for years.
Yes, I have.
Someone just asked me today, who should I go to see for a dermatologist? And they mentioned this, and it was crazy because we were taping the show today.
That's
I
nice.
said, well, actually, go see
That's
Dr.
nice.
Schleicher.
You can keep your eyes closed. I'm going to not cover her eyes with any cotton or anything like that because I want to kind of get up underneath here where women tend to get like the little fine lines and wrinkles. Now what we do is we go across gently, taunt the skin, and again I'm doing this a little quicker than I should be doing for time's sake.
Okay.
But this helps with the fine lines and wrinkles and any kind of hyperpigmentation from the sun that you often get, like the little tiny dark spots and things like that.
Now, Liza has great skin, but if
does.
there's someone who comes in and can you be a candidate if you have acne
Absolutely.
or rosacea? Or
Absolutely, because again, when we do this treatment for people who have acne-prone skin, what it does is it cleanses and opens the pores, so that whatever acne medications they're using, that'll help them to absorb better and get into the skin a lot better.
Is this good for teenage acne?
Yes.
Okay.
Absolutely. The only time we don't do these treatments for people with acne is if they're on Accutane, which is like a 5 or 6 month treatment for the cure of acne. And that's only because it makes the skin so dry, the medicine itself, that you don't want to do any kind of damage to the skin while they're on that medication.
Okay.
So when everything gets back to normal and maybe they have an occasional breakout or they want to do something nice for their skin, this is what we recommend.
I know you make the patients fill out paperwork.
Yes.
Does it include questions to the effect
does.
of, have you had Tylenol, aspirin, any kind of antibiotic medications that you're
Yes,
on?
well again, this isn't an aggressive procedure that we need to know about aspirin or anything like that. But a lot of times people will get, for instance, fever blisters, cold sores, and any kind of trauma to the skin, even though this is mild and gentle, any kind of trauma to the skin can bring out a cold sore in someone. So we always, a lot of places, if you talk about the microderms, they'll ask if you're doing prophylactic medication like a Valtrex or something. That's only for people who really do have a problem with getting cold sores. Because just like any kind of trauma, that can cause a cold sore. Even being out in the sun too long can cause people who have a tendency to get fever blisters to get those if they have too much sun exposure. But I don't think you have any of those problems. Do you, Liza?
No, not at all.
Okay. And her skin is already great. I don't know what I'm improving on here, but
Well, it feels very,
good,
very relaxing.
good. And again, I'm going down her neck, and this is,
It certainly doesn't hurt. It's not uncomfortable.
Now, is that on a lower speed?
I
or
have it about mid thing here, potency for her. I've been watching her skin,
Okay.
and it's not getting overly red or irritated or anything like that. So I think we're doing just fine with her.
Oh, okay.
Okay, and we're just wiping off some of the extra crystal that this emits. You'll feel like you're back on the beach because I think I'm getting it back in your shirt here a little bit.
That's okay. So what does that actually do? Shoot sand?
It's the aluminum oxide crystals. We refer to it as sand, but it's aluminum oxide crystals. And again, what it does is it takes care of all that dryness. It takes care of hyperpigmentation. If you're acne prone, it cleanses the skin, opens the pores. So it's good for a lot of things. Women who are older will do it for fine lines and wrinkles, or again, like I said, you get these things, what they call lenticos, solar lenticos, which are like the little dark spots, the hyperpigmented areas. It's good for, getting those under control.
How many times do you need this done before you see results, or is it instant? Because it looks like you have makeup on right now from just how even her skin looks.
Yes, yes. You can have these done. We usually recommend 3 treatments to start, okay? And they can be done safely every 2 weeks apart.
Okay.
After those 3 treatments, you can follow up with 3 more if you want to. If you're satisfied with, just those 3 treatments for the time being, that's fine. But the company recommends like a series of 6 treatments. At which time, after you've had those 6 treatments, 2 weeks or 3 weeks apart, then you can stop for a while. And people who've had these done, they can generally tell when they want another one, because they say their skin is starting to feel a little maybe oily or gritty, or they use different terms. But they kind of know the feel that they get after they've had one of these, and then when they feel like they need another one, it's pretty obvious.
Now, what does this do?
This just puts the natural pH back into her skin.
Okay. We're running
And
out
these
of
are
time.
just cool compresses.
So after this, we'll leave this on, and then she's pretty much, the procedure's
She
done
is
after this,
done.
right?
Let's see how she looks when I take these off.
Her skin looks amazing. I mean, it was amazing before. It's just, you can tell that, the sun damage
It feels amazing. It
And
feels
if you-
lighter. Like it feels like I don't have like a heavy sediment on my face or anything, and I don't wear foundation.
We follow up with a little moisturizer, and that's the treatment.
Very good. All right. How are you feeling?
Great.
All right, because Botox is next. Most people say that like, yes.
We're giving her the royal treatment
Stay
today.
with us. All your questions that you've been sending me, we're going to answer. You're watching Skin Sense right here on SSP TV. And we're back with a brand new show here on Skin Sense. If you're just tuning in, we just did microdermabrasion, and now we're back doing Botox, one of my favorite procedures, right? Every girl's face lights up if they're over the age of 30 with the Botox.
People
We're
love
back
it.
here with
Yeah,
Leslie.
people absolutely love it. They love Botox, they love fillers,
Yes.
they love microdermabrasion, something else, microneedling, which is really hot. And that's something we haven't talked about in a while. But that's using a machine that actually puts little tiny needles throughout your face.
It doesn't hurt.
So,
it sounds like
and
painful
we
when
have
you say needles.
We have a
but-
guinea pig here,
Yes,
so
we
she's
do.
already survived the microdermabrasion. So now we're going to do the Botox. And she's never really had Botox before. Okay, and Botox is a very, very simple procedure. Jeannine's had it, she survived.
Yes.
Okay, I've had it, I survived, so that's good.
Right.
And basically what we're doing is we're, in a sense, paralyzing the muscles. And of course, as we get older, our muscles just don't cooperate, and they get, our skin gets thicker, our muscles kind of contract more, and we just get lines and wrinkles. So what Botox does, it kind of relaxes that by paralyzing these muscles that just don't look that great. And what we do is we inject Botox into certain areas. Okay, for instance, we'll do an area right here. Okay, it's a common area to do, and that's what it feels like. Okay, it's very,
you
very
living?
simple.
I'm good.
And then we put a little Botox here. What we're going to do basically is give a little bit of an eye lift. So what happens, basically will hopefully help take out this little crease here.
Right,
And
the 11s.
We'll raise the eyes up a little bit. Right, the 11s. Okay, and then we'll do similar over here. There and over here. Perfect. Okay, and that's called the glabella area,
Okay.
technically. Okay, and we have this little, they call them bunny lines here. So I may put just a tiny, tiny, tiny bit in right there. Perfect. Okay, and the next area that we treat are lines up here.
Right.
And some people have more thicker lines than others, and really the thickness of the lines is dependent on the amount of Botox that you'll get. I never like to overly Botox people because number one, you look like you've been Botoxed, and number two, it's more expensive. The less you put in, well, the less expensive it is. So basically, we're going to work on these lines up here. So we basically, and again, since this is the first treatment, we're not going to overly Botox. And when I tell people first time, you come back in 2 weeks, and then we see how you did. Okay, and then we can see if there are any areas that may need little touch-ups. Okay, so we put here, here, and then I'll add up here. And we'll add up here.
So it takes a good
And
2 weeks,
here.
and I tell people that, like, you might
Well,
see.
Well, we're really basic. Botox will usually start working within 1 to 3 days. Okay, so certainly we'll have maximal effect within 2 weeks. And it can last 4 months, it can last, some people it can last 5 months. Okay, so that's a good thing about it.
And that's with
we
staying
have,
out of the sun and not smoking, correct?
well, all those things will make you age faster. Yeah, so we discourage all those things. Cigarette smoking, for instance, will cause wrinkles around your lips, which are very, very hard to, besides
okay?
causing.
Yeah. I'm
Besides causing lung cancer, okay,
Yeah,
so
yeah,
that's
right.
not a good thing.
Right.
Now we may need more Botox here because her musculature is thicker. That's why I'll have her come back in 2 weeks.
Okay.
And if we need more, it's very easy. And then we put a little Botox right in the so-called crow's feet, okay, which are here and around here. Okay, because these are very common areas that people develop these lines. Okay, and we'll do an area here, and normally I move around the table to do it, but because of the cameras here, we'll just do it like this, and this, and here. Okay, perfect. perfect. And I'm going to just use the remainder. Again, just genetically, you have a little thicker musculature up here. So we'll go out a little bit up here.
Now, what kind of bruising
little bit
could a
up here.
patient see with Botox, and how long would that last?
Yeah, side effects from Botox, one can get bruising, okay? Usually that's immediate because some people have, especially as you get older, your blood vessels are actually closer to this. Your skin is thinner, so your blood vessels are closer to where we're putting the Botox in. And it's very easy to puncture a blood vessel and get a little bit of bleeding. Well, if you get a bruise, it's going to last a week or so, and it's going to go away.
Right.
Okay. The other entity that you can very occasionally encounter or infrequently encounter with Botox, some people get a little droopiness of their eyelids. Okay, and that happens about 1 in every 100 Botox procedure. It's a little disconcerting, but the good thing is, just like Botox, it's temporary. Okay, so really there are drops you can use to help get the eyes to raise up. But again, that's why with somebody who's new, we don't overly Botox. All right, and she was a great patient, and you know, it wasn't too bad, right?
What are your thoughts on that?
Screaming.
Did
that's
it hurt?
a good
Not
thing.
at all.
It didn't?
And I'm afraid of needles.
Oh, you
so-
are? And I'm
And that wasn't
I'm
bad.
standing here with a needle. Gee, now you
No,
tell me.
I'm.
Gosh.
No.
Well,
I'm just saying for someone who would be
Right,
afraid
well,
of a needle
actually-
or not like them,
actually,
it
the
wasn't
needle,
bad at all.
yeah, the needle itself is so tiny that it's, it's barely visible to the human eye. Okay, and that's one of the plus factors of Botox. It's very simple. It's virtually painless, which is great. And what we'll do is I'll check back in 2 weeks, and we'll see if it's good, because this way we'll know which areas need touch-ups, and so the next time we'll be able to, if she needs more Botox, we'll be able to add more Botox if we need it. Again, I just don't like overly Botoxing people because people look phony. And if you look on the newscasters on TV, they have Botox, and you can tell.
Everyone has Botox. It's like the
Everybody in
natural.
the
We were
world
talking
has
during the
Botox,
break.
yeah.
Pretty much everyone has Botox.
Yeah, it used
if
to
you're over
be-
the age of 40.
Yeah, it used to be when I had my office in Philadelphia,
Oh, gosh.
Botox, Botox, Botox. But then when I came to Hazleton, well, nobody really thought about Botox. Well, now, the whole world thinks about Botox. So it's just like
And it's affordable.
something-
It's very affordable.
Yeah, it's very affordable. Botox can cost as low as $150 to maximum here at least $300. Of course, if you go to Miami, if you go to Las Vegas, you're going to be charged double that. But this is this area, and that's what people should be paying for Botox, not getting ripped off.
Very safe.
So, well, that's the other good thing. Botox has been used for a couple of decades now. But not only is it being used for wrinkles and cosmetics, it's being used to treat migraines. Okay, it's being now injected in people's bladders. I had a lady who actually lost her voice because of a muscle problem. Botox is being used into the areas around the vocal cords. So it's a very, very incredible
Do they use
drug.
it for sweating too?
Oh yeah,
Under your
Botox
armpits?
is being used for sweating also, not only on the arms but for the hands.
Oh, okay.
And I have to say, for the arms, it's not bad. For the hands, yeah, putting little needles in, you have to put about 25 to 50 needles in each hand. So that's a little tough. Plus, for the hands and arms, it's expensive because you have to use like 4 or 5 times the amount that you use for the face. So some insurance companies pay it, most don't, and you're talking, anywhere from $600 to $1,000 for a
Right.
treatment. It does last longer, and if you have a real major problem with sweat, if it's interfering with your life, that's one of the treatments that we might recommend.
Very good. Well, running out of time. Every time we do procedures, the time flies. Liza, thank you for being our guest
you.
today.
Thank
Hope
you,
we
Dr.
pampered you a
she's
little
fine.
bit.
Absolutely.
And then we'll have her back for microneedling.
There we go.
Okay, this
All
is
right.
great. She's
you-
donating her body to science. by the way.
Absolutely.
Just to let everybody know.
If you have any questions, keep them coming on Facebook, or you have access to us either by email or phone. And any procedures you want us to talk about here on Skin Sense, let us know, and we will be happy to do that for you. Thanks for joining us here on Skin Sense. We'll see you next time.